just going to start where we started with the whole dissection, and that's going to be in the cephalic region. So when we started with this, we exposed the masseter muscle. As you see your masseter here. And this is going to be a muscle that is going to elevate the mandible, as in chewing. A synergist to this is going to be the temporalis muscle, which is further up, overlying the temporal bone. Let's make our way down towards the inferior aspect of the jaw. Here you see your two digastric muscles. Right, so the digastric muscles are going to be antagonists to the masseter. The action for these muscles is going to be to depress the mandible. Right? Depresses the mandible as in opening the mouth wide. In between the two digastrics, you have the mylohyoid. And so the mylohyoid makes up the floor of the mouth, and it's also going to elevate the floor of that mouth. Making our way down from there, you see the sternohyoids. And so there's going to be these two band-like muscles that are overlying the trachea or the windpipe here.
Like superficial?
Yeah, these superficial muscles here. These guys then are going to depress that hyoid bone. It would be here. Now in the cat, as we move out from there, you would have your cleidomastoid and your sternomastoid. In humans, this muscle is going to be made up by a single muscle. These two muscles will be made up by a single muscle known as the sternocleidomastoid. Right, so again, in humans, sternocleidomastoids here. If you're bilaterally contracting the sternocleidomastoid, it's going to flex the neck. And if it's unilaterally contracting, you're going to rotate the head, and it's contralateral rotation. Right? So if you're contracting the muscle on the left side, your head is going to turn to the right side. Right?
Can you go over where's the cleidomastoid and where's the hyomastoid on the cat?
Say that again.
The cleidomastoid and like
The sternohyoid would be these.
Right.
Right. The cleidomastoid is actually hard to see because it's not separated very well here. But along this area, you would have that. No, you're not going to see it here.
Okay.
You would have the cleidomastoid there running pretty much along the same length and the same direction as the sternomastoid. Right? So those are going to be those guys there. If we move down to the chest, this is where you had your two landmark muscles that are cat specific that we're just going to name. The pecto antebrachialis and the xiphohumerales. The muscles we're interested in are between them, right? And so here are your two landmarks. Here's your pectoralis major and the pectoralis minor. Right? As far as the pectoralis major, remember the action is to immediately rotate that humerus, right? And it's going to also help with adducting the arm, ADD, right? Adducting the arm. Here's your pectoralis minor, which the action here is going to be to protract that scapula, right? So that you're kind of turning that scapula laterally and reaching out for something, right? So that's the pectoralis minor, right? And those are the two superficial chest muscles that we're interested in. From there, we move down to the abdomen. In the abdomen, we're going to have four muscles. Two of them are superficial. The first one, the most visible one, is going to be the external obliques, right? Kind of on the lateral aspect, and then towards the medial aspect, you have the rectus abdominis. And for the external obliques, you're looking at rotation of the trunk as well as compression of the viscera. And for the rectus abdominis, you're going to be flexing the trunk. As you go deep to the external oblique, you see the internal oblique. And again, notice the difference in fibers. Fibers for the external oblique are going down towards the pubic bone. Fibers for the internal oblique are going up or pointing up towards the midline of the body. Right? Now this guy is also going to rotate the trunk as well as compress the viscera. Finally, the last muscular layer of the abdomen is going to be your transverse abdominis, which will only compress the viscera. Those are the abdominal muscles. And as we make our way down to the leg, the superficial muscles that you would see in the cat, essentially covering everything, are going to be the sartorius, this large band-like muscle here, and the gracilis. And keep in mind, in humans, you don't have that same type of wide muscle. Instead, in humans, the sartorius is just a thin band, as well as the gracilis on the medial aspect. As far as the sartorius, this guy is going to laterally rotate the thigh, as well as help flex the knee. And for the gracilis, this is also going to be involved in knee flexion and assist with adduction, right? ADD, adduction. Right? Going deep to the sartorius, the first muscle that's kind of visible here is attached to this tendon sheath. All right, so this is the iliotibial tract. And the muscle that we see here is the tensor fascia lata muscle. This is going to be involved in extending that knee. As you go deep to that, you see the quadriceps group. So we have 4 muscles here. I don't know what side is better. I guess this side. Here you have your rectus femoris in the center, vastus lateralis lateral, vastus medialis medial, and then deep to this rectus femoris, you have the vastus intermedius, which is kind of hard to see in this particular cat, but that would be the 4th muscle, right? So rectus femoris, vastus lateralis, vastus medialis, and then vastus intermedius. As far as the action here, the main action I want you guys to consider is extension of the knee, as well as flexing the thigh at the hip. Right? So think about that for the quads. As we go deep to the gracilis, on the cats, you do see some hamstring muscles here, which would not typically be visible in the human from this view. So for now, we're going to disregard these. And we're going to make our way to these muscles up here, which are the adductor femoris, which is this big triangular muscle that you're seeing here. The adductor longus, and then deep to that, the pectineus. So in humans, we don't have an adductor femoris. Instead, there's a large adductor magnus. There's going to be relatively deep to the adductor longus, which is seen here, and then to the pectineus as well. The pectineus itself is fairly deep. Right? As far as a good way of remembering the pectineus, it's going to be medial to the blood vessels. Right? The action of all of these is pretty much going to be to adduct, adduct the thigh, right? As well as medially rotate that femur. Finally, the last muscle to consider here is going to be a fairly deep muscle that will be just lateral to these blood vessels, and that's going to be your iliopsoas. Right, so there's a branch of the femoral nerve there. If you look deep there, you see that muscle. Right? That is your iliopsoas, and this guy is going to be involved in flexing the thigh at the hip as well. So that's that guy. If we go towards the the crural region. Again, this wasn't completely exposed here. Let's check out that cat over there.
We can just walk over there, or
we
do
can
you
walk
wanna
over.
move
So you can pause that video.
Just walk over. Oh, you can push it. We gotta go down there.
Yeah, you guys go.
Crural? Yeah. So let me see where you guys did this. Alright, so we're looking pretty good here. Alright, so I guess continuing from the thigh region here, the medial thigh, we're going to make our way back down towards this crural region. And here you start with your tibialis anterior. Right, so you see the tibial tuberosity there. You see part of the tibia there as well. So we're going to kind of go lateral and posterior from this tibialis anterior. So the tibialis anterior is going to dorsiflex the foot. So it's going to lift the foot up like this. It's also going to invert the foot, as we learned this semester. As you go posterior to that, the next muscle visible here is going to be your extensor digitorum. The extensor digitorum here, which clean too much there, but you should be able to see this large visible tendon right there, extending towards the digits, right? And of course, as the name implies, this guy's going to extend those digits. Moving on from there, the next major muscle that you're going to see here, associated with this visible tendon here, is the fibularis longus, or the peroneus longus. And this guy's going to be, is going to function to evert the foot, take it sideways. And then finally we get to the last two muscles from this kind of lateral posterior aspect. First you see the soleus, and then the gastrocnemius. Right? And the gastrocnemius is that large calf muscle. Both of these are going to plantar flex, so you're going to extend the toes, right, as if you were stepping on the gas pedal. Right?
What's the soleus?
So soleus, gastrocnemius.
Oh no, the one before the soleus.
Fibularis longus. Right? Or peroneus longus.
And this is the extensor.
Extensor digitorum, technically the longest. You can get away with just extensor digitorum.
Okay.
And then again, tibialis anterior.
Okay.
All
We
right.
didn't do hamstrings, did we?
Not yet. We're getting to the hamstrings. So here you get a nice good view of the entire gastrocnemius with the Achilles tendon. Now as we make our way back up towards the posterior thigh, you see the hamstring muscles. Right, so these are the same hamstring muscles that earlier we saw from the anterior aspect, but now we're seeing them from this posterior aspect. When you look at the hamstrings, there's going to be three muscles. Right? The large lateral muscle is going to be the biceps femoris. So this is your biceps femoris here. As you go medial, the superficial medial muscle is going to be the semitendinosus, and then deep to that you see the semimembranosus. Right? You see it on both sides. Right? So the action of the hamstring group, one of the main actions I want you to consider is flexion of the knee. But when you consider the biceps femoris, this is going to play a role also in kind of abducting, abducting the thigh. So think about that biceps femoris for that as well. But otherwise, flexing the knee. Right? And you can consider the last thing for this one, extension of the thigh at the hip. Right? And it's going to work in conjunction with the gluteus maximus to do that. Right? So as we move to the glutes, here you have a cat-specific muscle, the caudofemoralis, that you can use as a landmark. As you go cranial to that, you have your gluteus maximus, and then in the cat, the gluteus medius. Right? So gluteus maximus superficial, gluteus medius deep. This is how you would see it in the humans as well. As far as the gluteus maximus, the main action here is going to be extension of the thigh at the hip, as well as function to help in, again, abduction of the thigh. Now, as you get to the gluteus medius, this is also going to be abduction of the thigh. Right? Moving up from there, you have the erector spinae muscles. Right? So we see the erector spinae muscles. You have the spinalis, the longissimus, and the iliocostalis here, from medial to lateral.
Can you repeat it again?
So the spinalis, the longissimus, and the iliocostalis, the most lateral.
Do we need to know the three separate ones? Lance and Lahima.
We do, right?
I thought on erectors you said as long as we knew they're erectors.
Check the study guide.
Okay.
If the three names are there, then you should
Okay.
be aware of. Otherwise, it's just erector spinae.
Okay.
Right? These are the anti-gravity muscles. They're going to extend along pretty much the entire length of the vertebral column, and they're going to basically extend the vertebral column during bilateral contraction. Right? So bilateral contraction, you're extending. Unilateral contraction, you're laterally flexing that vertebral column. So those are the erectors. As we continue to make our way up, we see the latissimus dorsi. Right? So we see the latissimus dorsi on both sides. This is a large muscle that is going to function to medially rotate the humerus as well as extend the arm. Right? So
So it probably
Totally
serves
that
more
part.
purpose in an animal from how you're talking about extending the arm.
Yeah, because I mean, all it's doing for us is again that backswing that you were not too
That's just
impressed
some
with.
special swimmer, maybe.
Maybe, yeah. So as you go up from there, you have your trapezius muscles, which remember in the cat there's three different ones, but in human it would just be trapezius. But I do want you to know the cat ones here. So at the top you would have the clavotrapezius, the acromiotrapezius, and then the spinotrapezius. You can see there's separation there. As far as the action of the trapezius in humans, you're going to look at extension of the neck, right, and elevation of the shoulders. Those are the main ones. You can also think of depressing the shoulders, right? So those are the main actions for that trapezius muscle. As you go lateral to the trapezius muscle, still staying superficial, you see the levator scapulae ventralis here. tiny little band. The levator obviously is going to elevate the scapula, bring that scapula towards the cephalic region. As you go lateral to that, you see the deltoids. Okay, in humans, you want to consider that the deltoid does have anterior, lateral, and posterior fibers, which will perform different actions. But generally speaking, when you think of the deltoid, the main action I want you to consider is abduction of the arm. Right? AB, abduction of the arm. As far as what you're seeing in the cat, for the 3 different deltoid muscles, you have your clavodeltoid, your acromial deltoid, and your spinal deltoid. As we go deep, and this one is not finished here. Is that one finished? Let's go back to that one. Is it? No, that one's not finished either. So, you have a scalpel?
We have the